We're rolling. Okay. Thank you very much. Good morning, everyone. I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on this Tuesday, March 19th, 2024 at 8:31 a.m. I'm looking for approval of the consent agenda unless there's a item or that a commissioner would like to pull and discuss further, or a board member.
I'd make a motion to approve the consent agenda as written.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
I'll support.
Thank you, Commissioner White. We have a motion and support. Any further discussion? Hearing or seeing none, all in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. One thing I just failed to do with the consent agenda was modify our whole agenda, so forgive me, but we want to include just an item for introduction of Rocio and our new staff, so I'll hand it over to Allison here.
Yes, thank you, Commissioner. Really excited to welcome Rocio Rivas to the Public Health and Human Services team. She joined us in February as an office support specialist. Case aide, is already deep into systems learning and all of the different workflow procedures for helping residents connect with services through Public Health and Human Services. So just thrilled to welcome Rocio.
Welcome.
Welcome.
You want to say a few words or anything, or?
I'm happy to be here.
Yeah. Yeah, we're happy you joined the team, and we're very lucky that you joined the team. I don't know Rocio very well personally, but a little bit, and can certainly attest to her character, and then have peers who have worked with her too. So I'm very excited to have her on the team. Welcome. Yeah. Great to see you this morning. And then moving on to our staff report. We have our age-friendly communities, and we have Andrea Tofte and Grace Grinager and Julie Wilson, and somebody I don't know.
I can introduce our fourth presenter. So this is Georgia Lane. She is a planner with the Arrowhead Area Agency on Aging, who is with us to co-present on the findings of our Age-Friendly Communities project in Cook County and Grand Portage. So really happy that she's here with us this morning.
Thank you for joining us, Georgia.
Absolutely.
Well, take it away.
All right. So we do have a PowerPoint, which is coming up here, so you can see all of our names again. So we've got Julie Wilson, myself, Grace Grinager, Georgia Lane, and then Andrea Tofte. So we've all been involved with getting the Cook County Age-Friendly Community Initiative off the ground since probably about a year ago, when we started to talk with the AARP and the Arrowhead Area Agency on Aging about this opportunity. And we had both the AARP and Georgia join us at one of our PHHS advisory councils to tell us a little bit more about what age-friendly communities is and how we could fit ourselves into the bigger picture here locally. So I'm gonna have, actually, can I do the slide advancing? Oh, okay. That sounds good. Okay, so we're going to have Georgia start with kind of grounding us in where we fit in the bigger picture of age-friendly communities globally, nationwide, and also here within the state of Minnesota. This was a project that was funded through a grant through the Department of Human Services, the Minnesota Department of Human Services. Minnesota as a state has been designated as age-friendly and is working to try to push that idea out by encouraging local communities across Minnesota to adopt this framework and do work on what it might look like to have age-friendly as a concept really spread throughout the states. And so after Georgia grounds us in what that means, we're going to be, Julie, Andrea, and I are going to talk a little bit about what we did here in Cook County and what we learned from the project that was really heavy on community engagement. We did a combination of listening sessions, or community forums is what we called them, and also a survey that got really robust participation. So we'll talk a little bit about what we learned, and then afterwards talk a bit about what next steps might look like for Cook County based on what we found and where we could fit ourselves into the bigger picture of age-friendly communities. So, Georgia, I'll have you take it away.
Great. Thanks so much, Grace. And thanks for letting me be here this morning. My name is Georgia Lane. I work for the Area Agency on Aging. We work under the Minnesota Board on Aging, as well as the Arrowhead Regional Development Commission. So age-friendly communities, Grace, you just did such a really good, succinct job of explaining what it is. It really is a global movement. In 2006, the World Health Organization launched the Global Network for Age-Friendly Communities to really look at a global aging demographic. In 2012, AARP became the U.S. affiliate for that, and in 2019, Minnesota as a state, our Governor Walz launched a Governor's Council on Age-Friendly Minnesota to really think about how do we look across state departments, across a variety of sectors to think about preparing for a changing demographic. So age-friendly communities aren't just things that are good for, the old people, quote unquote. It's good for people of all ages. We are all aging. From the moment that we're born, we're aging. And so we think about from birth to death, how do we have communities that are livable for people of all ages and all abilities? Some of this work is being brought on simply because of our aging demographic. We know that close to 1 in 3 people in rural counties are 65 and older, and that's going to continue to grow. So yeah, go ahead and go to the next slide. So I'm just sort of speaking freely here. So some interesting facts. In 2020, we have more people 65 and older than we do school-age children in Minnesota. My guess is that Cook County is probably a little bit ahead of that demographic just simply because rural counties are aging more quickly. 20% of community-dwelling older adults receive supports to Older Americans Act services. These are the types of services that organizations like Care Partners of Cook County provide. And only 93% of people live in the community. So often when I go and talk to community groups about aging, they often, automatically think nursing home. They think assisted living. They think people who are frail and the elderly. And the way that we think about aging tends to be associated with decline and disability. But what age-friendly communities is about thinking broader. We certainly need supports, we need services, we need healthcare, we need all those things, but we also need to think about how do we stay active and connected and engaged and leveraging those opportunities. So the age-friendly framework really sort of broadens the conversation and thinks about aging in a more broad spectrum. So next slide. So you can see here our demographics, right? In 2020, 2030, 2040, you continue to see these going up. You can go to the next slide. You can see here in Cook County, as I mentioned, close to 1 in 3 people are 65 and older. Next slide. And I spoke to this a little bit. We want to think about shifting perspectives, and this is really part of the benefit of applying an age-friendly lens, is that we think about modern elders versus thinking about senior citizens. How do we all age successfully? This is not a one group of people that think and act and feel one way. It's a unique set of needs and preferences. And so we're really thinking about disrupting the us versus them binary. So not talking about what they need as older adults. It's what do we all need to live healthy lives until the end of our life. So in 2019, as I mentioned, the governor launched a Governor's Council on Age-Friendly Minnesota. I think you guys are really blessed with some amazing folks here in your public health as well as your community organizations who glommed onto this idea right away. And actually, our legislature has allocated now $6 million to invest in age-friendly funding. Cook County Public Health and Human Services was a recipient of one of these grants, and there has been an expansion on this grant as well. So you guys are part of a bigger movement, and I really think that on a statewide level, one of our missions as an area agency on aging is to make sure that our outstate voices are heard at a statewide level. So really understand, these are state dollars, and aging in rural Minnesota looks much different than it does in aging in metro areas or even in Duluth or in places like St. Cloud and things like that. And so it's really important that this story here is told, and that's part of what my hope is as we continue on this path. So how is it organized? So Age Friendly is sort of a tool that can help serve as a roadmap to make changes in your community. It's a way to kind of bring like-minded organizations together who might be working on similar projects, kind of looking at a 5-year planning process, and I think Grace might get into that in a little bit. And it's structured under 8 domains of livability. This is the typical AARP thing, so it could be focusing on housing, transportation, or outdoor spaces. So you sort of look at your built environment, and then there are things like respect and social inclusion, social participation, workforce. So we talk about civic engagement and employment. And so each one of these domains could be tackled on their own, but we also know there's a lot of interface in between the domains. So when you talk about transportation, that affects social participation. When you look at housing, that can affect your workforce. So, and the age-friendly framework doesn't only have to focus on people who are 60 and older or 65 and older, because we know that, basically old is a subjective term, right? You're not one day young and then the next day you wake up and you're old. It's throughout the life cycle. So these are all interconnected domains. And then disaster preparedness was an added domain during, a lot of this kind of grew up during the pandemic in Minnesota. And so they said we really need to look at our disaster preparedness as integral to the age-friendly framework. And so there is a lot of information that we could go into, but I think this is just the start. And I will, pass it on to Grace.
Great. So this is the way the AARP network has things lined up. So we are in the pre-planning phase. We got this grant to do community engagement and learn what our community's experiences are like and what the needs that we're hearing about are. We also received expansion funding to continue this work into the future through DHS, and to use what we learned through this process of community engagement and try to come up with a roadmap that can guide us into the future. And one thing, without getting too far ahead of myself, is that we found that this really nicely overlapped with our community health assessment findings, and so we're hoping to make the two processes dovetail and use this age-friendly lens within our health assessment and our health improvement plan, rather than coming up with two completely separate documents. And so I'm going to have Julie and Andrea talk a little bit about what the engagement actually looked like here.
You can go ahead, Julie, if you like to do that.
Oh, you do the methods.
The methods.
You're up.
Alrighty.
I think this will reach.
Thank you. Okay. I'm just gonna walk you through, and good morning everyone, thank you for being here, about how we implemented the age-friendly. So first we thinking, okay, AARP gave us a framework for the methods. They suggested to do community listening sessions and the survey. So with Julie Wilson, who is my collaborative partner, so we brainstormed and we thought about where can we go. She already had a vision because she does a lot of outreach with her work. So some ideas were, kind of in the table already of going to all these different town halls or going to community centers. Through Care Partners, she has a board and members of Care Partners, and those were key to help us go to these different locations. So we came up with a list of locations that slowly and gradually increased to 10. We ended up going to all parts of the county. But we can go on depth later. No. Go back. Yeah, sorry. And so we did the forums in several locations. We did the survey. For the survey, I built the survey, but it was based on the framework given by AARP. That it was a questionnaire of more than 100 questions, and I targeted to our community characteristics and needs, so it was less questions. So, and then we did some outreach, and then what we're gonna show you is the results and the discussions in the next following slides. So I'm not gonna go too in depth. This is kind of give you the framework of what we're gonna show you next. Okay, that's good. So I present the survey. I present this. Okay. So, here are more of the specifics that I was just explaining about the survey. So 86 questions. Most of the questions were within the 9 domains of livability. We were super lucky to get 324 responses and completed survey 164, which take us to a completion rate of 51, as you can see. And we had it open for about 4 or 5 months. And those, I just put it a screenshot of where we see our result surveys. And so we were looking at that when we launched it, like 100, 120, 100. We made it. So, and that was like that's the first page that you will see in the electronic version of the survey.
I have a question before, you might not know the answer, but, so I took the survey and it was long and great, but long. So I'm just curious, like with the partial completions, did you notice where the attention just, okay, that's long enough? Like,
I think when we go through the slides, and at some point you would be able to see if we somehow share part of the survey results. Per question, you have how many respondents you had. So gradually you can see whether people got lost in the middle, whether it was too long or the phone snap or something timed out. Some of the feedback that Julie got from people that connected with care partners was like, you know what, I just got too long in my phone, it was impossible, then I left it for later and then I lost it. So we think part of those partial surveys might have been people that went in later and completed that. So those are things to disclose when we write our findings.
I have a question too. How were the surveys distributed?
So what we had them in physical copies in several locations. We had them here at the courthouse, at the library, at the hub, and at Care Partners. As well, you were able to do them online. We had flyers in different physical locations, laundromats, library, Johnson's, grocery stores, in which you could go to the QR code and capture it with your phone, and then you will have the link later. You were also able to go on Care Partners website and access to the survey link directly from that. And then Julie was on the radio quite often explaining the community where the survey access was available.
Okay, I just asked because my wife and I are obviously both over 65 and I hadn't even heard about this, let alone had an opportunity to take it. So it's kind of Grand Marais town centered.
Yeah.
If you're at the courthouse, you're at Johnson's, you're here, you're there, you're already plugged into Care Partners, you know about it. Otherwise, okay, first I heard about it. There's 1,900 people over 65 in Cook County. And I was wondering why you got only 324 responses. Thank you.
Okay.
We got more to share.
Okay. So then, now I'm gonna go.
Okay, to your point, we had a lot of conversation about this, and that's been a goal for Care Partners, on a side note as well, to be very aware of that. So what we decided on is to really take the time to go out to every, obviously not every nook and cranny, because there's all kinds of little communities all over Cook County, right? But we did do 10 listening sessions last fall mostly. We had one just about a month ago at the YMCA. That was kind of an add-on. And that was sort of a request of the YMCA. It was a partnership there. That was nice. But we went up to Grand Portage, to Hovland, again, Grand Marais at the library. We went up to Mid Trail. We went to the end of the Gunflint. We were at Lutzen, Tofte, and Schroeder and did listening sessions. And this was really an extraordinary experience for us. It really, all of us know that the pockets of our community in Cook County are different. We have different little mini cultures in our county. And it was really interesting to do those listening. While you kind of know that intellectually, it was really interesting. Of course, some of the key things, same things came out, of which domains were really the most important. We're very similar in some ways. But the beauty of this is we also didn't have a lot of groupthink because we had these small conversations. And I would say beyond these official 10, I had a lot of opportunities to talk to people, and I know these guys did too, informally, and it was really, really good conversation. We were at different events and all kinds of, different areas. Anywhere we went for any other reason for Care Partners, or I'm sure Cook County, we had the surveys with us and had some good conversations with people. But it was unique and interesting, and because it didn't have groupthink, it was interesting to think about some of the concerns. Obviously, housing is a concern over and over again, but the uniqueness of, considering, on the West End, if I ever do have to leave my country home, I don't want to have to move to Grand Marais. It's like the big city. Really wanting to be able to get an apartment in Lutsen, or stay in their community, or in Tofte, or right in the, and so there isn't that option available, or there's a fear that there isn't. Certainly, the further east you get, transportation and concerns about that. At Hovland, things about there isn't even around the year groceries. Considering things like the meal delivery is only 5 miles out of Grand Marais. Well, that eliminates a whole lot of people. And so just a lot of really good information and conversation that came out of these community listening sessions. So we were really grateful that people took the time to share their, and I would say the 300, that's actually statistically a really good response that we got. I think we did really well having 320, whatever it was.
324.
So, yeah, it was, yep.
And I betcha, I know it's not an either or, but I betcha there was information gleaned from the listening sessions, a little more depth than
Yes.
the survey itself, and
Yep.
more engagement and
Yep.
some of the nuance and.
Yeah, and people, it wasn't directed. It was much more of a, so the things that happened at the listening, and some of you were there, the things that happened at the listening sessions were, asking them just broadly. It really was listening, right? We weren't trying to direct the conversation. So it was asking folks, what they loved about living in Cook County, what they wanted to preserve, and what was important to preserve. Asking them what was an area of concerns for them, for them. And it really was just asking broad questions like that and getting conversation going. And I would say predominantly we had folks over 60. In some pockets, like in Grand Marais, we did have some more young people and maybe professionals that work with older adults. And again, we wanted to capture everybody, but it certainly is, mostly older adults that participated throughout the county. And then in Grand Marais, it was really a mix of ages. So it was different conversation. I would say in Grand Marais, there was a lot more expression of wanting to make sure we maintain, as they age, access to go to the, to go to events in town, and figuring out how to make things accessible in Grand Marais. Different conversation than the real practical matters all around Cook County. So it's almost like in the Twin Cities versus, it was almost kind of funny in that regard. But it was really wonderful, and we're so grateful people took time.
Thank you for
to do
pointing
that.
that out. That's
Yeah.
a great response to my,
Yes, thank
to my
you.
question. And now I understand why I hadn't heard about it. I was out of the county having knee surgery during those 3
Oh,
months. So
yes. Yeah, you might have missed our
So I
PHHS meeting
missed
that
out- I
time,
missed
too.
out.
Yeah, right.
Thank
Well, this isn't meant to be critical, it's meant to
Yeah.
be in jest, but.
Yeah.
Do you think if I would have went to the listening session, it would take less time than the survey?
It was about 20 minutes.
It was 15 to 20, yeah.
So it was long. How long?
Our listening sessions were an hour and a half.
You got cookies at the
You did get cookies,
See,
or bars.
I didn't play my
And
cards
Andrea and
right.
I, so,
Getting cookies from a local bakery.
I missed out.
Touche though, Dave. Yeah, and then I will just say, to speak, Andrea already touched on this, but I'll just quickly go over this slide. We did radio announcements and radio spots. I did a special where they interviewed us about this project. CJ interviewed me and had some good conversation there. Of course, she's always fun to talk with. We did a lot of social media across, and that hits a certain amount of people, but not everybody. But it's a great place to catch people. Both Cook County and Care Partners, and then all of the community pages we could think to get out to. And then we had a lot of people sharing personally as well. So we did our best through that venue. We had flyers up and down and all over the county for this in every area's post office. That's what we heard in the listening sessions too, is that is where they, on the West End in particular, where they look for information, is at the post office or in those community spots. And certainly up the Gunflint, I'm probably digressing a little bit, but communication was one of their key things. They don't really know where they get it from. WTI, local, anything specific for them is word of mouth, neighbors. That was, especially for folks that were new to the Gunflint, really struggled to know where they got information. So that was, communication was huge there.
That's very
I
valuable.
can talk about Gunflint.
Yeah.
The best way to reach Gunflint residents is through the property associations.
Yes,
You got Gunflint,
yep.
you got Seagull, you got Greenwood.
Yep. Yeah.
So one email
Yep.
to the president of the association.
Yeah.
Asking if they put it in the monthly newsletter, and it'll get out to everybody.
Oh, there's a monthly newsletter, that's good to know.
Nice.
Yep, thank you. We did learn some of those things as we went. Yeah, we keep saying, "Gal, next time, we're going to be really good at this."
Yeah.
Yeah. This is you. Mhm. And this works now.
Okay, so which one advances? This top? Okay. All right, so I'm going to go into the survey findings a little bit, and I also want to say we have a great deal of information now, and so this is kind of a high-level overview of what immediately rose to the top as concerns and experiences. But in our expansion grant, we did put aside funding to contract with an organization like Wilder Research to help us really dive into the data and dedicate the capacity to doing that in a way that internally we just don't have. So our plan is to write all of this up and do community presentations again to say, this is what we learned. Is this an accurate reflection of what you all tried to tell us or not? And so this is the beginning of showing these findings, and it's not as deep a dive as we would like to do. So this is the sneak peek of our top findings, I would say. So question 18, you can see we had 236 people answer this. And I was surprised that only, about a third of respondents said that they thought Cook County was a good or very good place for people to live as they age. So,
Could you read the questions? We can't
yeah.
see it from here.
Okay, so number 18 was, how would you rate your community as a place for people to live as they age? And we had 5.9% say very good, 30.5% say good, 45.3% say fair, and 18.2% say poor. So it wasn't generally rated as a great place to grow older, and I think some of the specifics come out in the specific questions. And you can also see who answered the survey. So this was one of the last questions, so you see participation dropped. But the majority of respondents, about 42.5%, were between 65 and 74 years old. So we did have some, about just under 12% of respondents were under 45. So we had a diverse range of respondents, but generally they were in that 65 to 74 age group. And this is, again, kind of a hard one to see, but this is where we saw our findings really align with the health assessment. So the question was, when you think about your community as a place for people to live as they age, which of the following community areas need the most improvement? Please select up to 3. And the 3 that very clearly rose to the top were housing, transportation, and access to healthcare. So 66.4% of respondents said housing was the top concern, 64.7% said transportation, and 58.2% said access to healthcare. So all 3 of those areas are priority areas in our community health assessment. So it was affirming to see that that was the same for this. So this is looking at by those domains of livability, and again, housing, health services, and transportation clearly rose to the top as concerns for respondents as they were thinking about our community using this age-friendly lens. The image on the left is kind of looking at what came up in the forums as priority areas. And it's a little bit hard to read, but that magenta color, that's housing. And so by the number, you can also kind of see where we got the most participation, which was actually in Grand Portage. We had a really great turnout in Grand Portage for the community forum. But so by far and away, housing rose to the top, followed by access to healthcare. And then in red, that is the transportation. So that's a little bit of a challenge to see, but it's just a different way to visualize the same thing, what was coming up over and over again for people.
Grace, the bottom scale, was that numbers of people or?
Yes, that was the number of people at the community forums.
Okay, so in Gunflint, there was 4. Okay, thank you.
Yeah, the mid-trail. Yeah, but the Zoom and the YMCA are not represented.
Yeah, I didn't record because.
Oh, the Zoom had 30-some people, and the YMCA wouldn't have.
Yeah.
15, but we didn't.
Not sure what happened.
Great, thank you very much.
The votes.
Oh, yeah.
The vote. Because this was by vote,
Yes.
not by the topic of conversation. I just want to clarify that on the previous slide, so the forum findings, at the end of the listening session, we would say to the participants, please write in this little post-it, what is your top 2 domains? That's how I rated these. So not from what I gathered from our conversations, because that is just more
Right.
reiteration of what we presented in the previous slide. And it has more value on ideas or ways that they would like to see changes. So those are going to be in their report.
Thank you.
And so this speaks to the transportation a bit. These are different questions from the survey. So question 25, I do not feel as comfortable driving as I used to. So when you put together strongly agree and agree, that is nearly 40% of respondents saying they do not feel as comfortable driving as they used to. So many of the people who responded, they didn't say, I'm struggling with communication right now. What they were really saying is, as I look towards getting older and feeling less comfortable driving, this is something I anticipate being a need, a growing need for me. Because when you look at the right side, which is question 26, to what extent do you agree with the following statements about the role of transportation in your life? Most people also say, and then 60%, almost 61% say, I have transportation to get to the places I want and need to go at the times that I choose. So again, this is more of anticipating a future need than it is recording a current need for people who answered the survey. Oops. This really is counterintuitive. And this is looking at the housing question. So one of the things that we have as a next step is to connect with Jason Hale and Teresa at the EDA and share some of the really granular findings we have about housing needs and what people are thinking, survey respondents are thinking about when it comes to their own housing situation. So this question 6, does your current residence need any modifications, changes, or major repairs to enable you to stay there for as long as possible? And we had almost 45% say no, but we had 40% say yes. So that's a significant number of people, almost 100 people responded and said, yes, we do need to have something modified in our home. And we do have other questions that we're not presenting today that look more specifically at what types of modifications are people looking for to enable them to stay in their home as long as possible. And then question 8, are you considering downsizing from your current home in the short or long term? So almost 29% of respondents said yes, they are. And so we do have more data there that we're not going to present today on, how soon would you be considering downsizing? What would you ideally downsize to? Would it be an apartment? Would it be a smaller home? So we have a lot of really good information that we're hoping to share with local leaders in the housing space to provide them with additional information to aid them with planning as they go forward. And that's the sneak peek of what we found. There's nothing specific about access to healthcare services that I'm presenting on today, although that is something that both through the health assessment and through this project, the next steps there are really to connect with local healthcare leaders at the hospital, Grand Portage Health Services, and Sawtooth Mountain Clinic to say, this rose to the top. What are your thoughts on, we want to make sure this is on your radar, and also what information do you need to kind of plan your next steps as people have concerns about healthcare access? What does that mean for you operationally? So trying to facilitate some discussions with local leaders is the next step when it comes to the healthcare access priority. I'm going to pass it back to Georgia now, because this is just kind of a visual representation of where in the state of Minnesota have communities opted to join this age-friendly communities network. So we are going to have an ask of all of you, and that is and it's not going to come today, it's going to be at the next PHHS board meeting. The next step would be to sign a proclamation declaring that we're supportive of the age-friendly communities approach, and a letter of commitment if we in Cook County would like to join that network. And I'm going to have Georgia speak to what exactly that would entail, because she's worked with other communities who've done that, and she might be able to answer questions and provide a little bit more information on what that process has looked like in other places.
And can I just say, we're so lucky to have this.
You guys are doing all the work. So as you can see, I think there's 22 on here, but it's a growing movement. It's been so fun to see communities embrace this. And in terms of community engagement for where you guys are at, you really knocked it out of the park. I think based on your surveys, you exceeded what Duluth did. Duluth entered the network in 2021. So yes, it seems like we didn't get everybody's voice, but this is just the pre-planning phase. So really that year one is ongoing community engagement. You guys are ahead of the curve, because typically communities don't do this level of assessment and engagement until they're in the network. So you guys have so much to build on and a strong foundation, and it's really designed to create a buzz, spark community conversation, get people engaged. We are, once you're officially in the network, you have access to actually everybody in the United States. There's a kind of an online forum that you can join. There's quarterly meetings where you can sort of talk to other communities. I will really point you to the neighbors in Lake County who are they're 2.5 years in, and really honed in on housing as well. There's some housing planning happening in Crystal Bay Township. And so every community is unique, so it's not a cookie cutter approach, but you don't have to reinvent the wheel, and you're really kind of plugged into a lot of other work that's happening. And what else did I want to say? I think it's so important that we tell the story. There's a legislative task force on aging happening right now, and there's ways to submit stories around what's happening, and part of the advocacy work that's needed to continue to help folks realize why this is important. And we're here to support and walk with the communities on their journey. The work has to come from within the community. The conversations and solutions have to come from within the community. But our role as an area agency on aging is to help identify additional funding opportunities that could be needed for implementation. So for instance, if there's housing work or whatever it might end up being, to kind of point in the right direction, you have a feather in your cap as an age-friendly community to sort of say, we have a formal coalition that's working on this. And I think that can really open the doors. You're organizing, you have a structure, and to be able to sort of say, like, these are the things that we need to focus on, whether it's housing, transportation, whatever it might be. And we're here to help in ways that we can. So,
thank you.
happy to take questions or comments.
That's the end of our presentation. So.
Yeah. Thank you. Yeah, I like to try to look at things from all angles, right? So why wouldn't we make this commitment? Just because it's a commitment? Is that the...
It takes staff time. It
Sure.
takes Grace's time and
Sure.
Andrea's time and Julie's time. And the amount of funding that they currently have, I'll venture to say, it takes their time. But I think, Grace, kudos to you and other folks who identified that this actually aligns with the public health scope of work. So it's meant to be supportive of what's happening, and it's in alignment with the mission.
Well, that's a great point.
That's the
and,
only
you know,
thing. I can't think of another reason, but
No,
I'm
yeah.
biased, so you could maybe.
Well, I was looking. Right?
I have a comment,
Go ahead.
with housing. And this is just a random thought, but a lot of the housing you hear about needing is for young families or for workers. And maybe if more housing was for seniors, then where they're living now would be available for workers and young families.
I would just like to point you to, or any of you, if you missed Jason Hale's presentation through CCHE, had a senior housing, had Jason Hale come and speak to one of our lunch and learns last month. So if you go to the CCHE their website, you can search for the Zoom Care Partners Zoom, and Jason Hale did an update, and it was focused on seniors. So that would be a really great thing to do if you weren't there.
And I just would like to add that the survey is looking for that specific need, like the older adult needs in housing. And so when we ask the question, what do you need, or do you need modifications in your home to stay there as long as you can, then all the following questions are oriented to difficulties that will be faced by older adults. Regardless, they could be faced by anyone with mobility issues or cognitive issues or anyone.
Yeah, and there were questions in there around assisted living. Or if you were to downsize, would you want to rent, or would you want to buy a condo, or would you want to rent, or what size would you be looking for one bedroom? Like, we got some real specific questions in there, some data that we'll share with Jason. And I think, do you want to speak to why we can't just blast out because it has some confidentiality?
Oh, yeah. Yeah, so I forget who it was. Someone asked if they could just, log into the survey portal, but we can't do that since there is personal identifying information as at the end of it. But that's why we're hoping to, contract with a firm that has more experience doing data analysis, so we can come up with the findings in a way that's really professional and people can dig into.
Yeah, really, really specific questions we have.
Is the portal to take the survey, is that closed now, or is it still accessible, and could it be opened if necessary?
It is accessible, and we could reopen it. It's just a process of, we took the links down so that we could start to do the analysis, but we're absolutely able to reopen it. It's actually the platform is called Alchemer, and it's held through the CHB, and so we're able to use that for as long as we need to.
Do you think that might be useful to broaden the?
We could certainly.
I think you got.
Yeah, we could certainly.
Your pretty good, and you know what you need to know.
I think you guys are going to be required by AARP to have some type of official survey once you're officially in the network, and it could be like Duluth did like a 10-question survey because they had the full long one, and then they said at this farmers market we're going to focus on food access. Right, so they had, and they kind of targeted things, and then they had like a housing one where they had 10 questions. Mm-hmm. So there's sort of a way to, as you're looking into your official year one, to continue to seek community input while building on what you had. You don't want to like reinvent the wheel, but I think that that's a smart idea.
So this is a process, it's not a...
It's a process, it's a 5-year, in a designation doesn't mean you've done it. A designation means you're having community conversations, you're developing, getting community input, developing an action plan. So I think when you start to think about, yes, we know these are the issues, but how do we work cross sectors to come up with strategies? So I'll use Lake County as an example. Housing obviously comes up on many people's. And they are doing a big push on home modifications. So that's one of their strategies in partnership with a number of organizations, including their HRA. They are looking at intergenerational housing development planning process in Crystal Bay Township. So that was a very localized, that township board has got some implementation and funding to be able to do that. And another interesting thing, like thinking outside the box, this hasn't gotten to the top of their priorities because they're focusing on those other two, but there's home sharing models that are out there. So when you think about the number of people who are 65 and older living in their home with open rooms, right? How do you, there's a lot of, there's a lot of models there to look at home sharing. So somebody might need somebody to come in and shovel their sidewalks or plow their driveways, or they're up the gunflint. Is there somebody else? Right. So I think what some of this pushes and encourages is like, what are the creative solutions? Because change happens here. It's not going to happen. I mean, that's cynical. It can happen on a statewide level, but I think this is where communities can really. meet their unique needs.
Commissioner Storley had a question.
Thank
or
you,
a
Mr.
comment.
Chair. So I have a few questions and comments. So the networking is ARRP?
Correct.
Okay. I'm a member of that, and I really enjoy their educational part.
Yeah.
I can understand a letter of proclamation, but a letter of commitment, I think we need more information on how that will affect the board, because it sounds like you will be doing most of the work. What implications is it for the board?
I mean, I think that that's really up to each community to decide. I know that if you don't continue on with a process, AARP would take you off of their website and wouldn't claim you as one of their communities that's under the AARP network. I don't know that there's any kind of fine, consequences, retribution. There's no age-friendly police who are coming to make sure that you did things in the right way. And so we can look at the various ways, because sometimes it can be a letter of commitment, sometimes it can be a proclamation. Communities can kind of submit what they want, and we work pretty closely with AARP to see what works and what doesn't. Communities take it at their own pace. It took Lake County 2 years to get through their assessment. Right? It took Duluth close to 2 years. And we were living in pandemic as well, so everything is on a different time frame. But I think that there's a lot of flexibility in terms of the pace at which you take it. And some of it's like, where's the energy in your community and where's the need, right? And what's the leadership? So,
I guess my next question is then, is there a monetary obligation down the road?
No.
Okay.
No.
So if we do a proclamation, do we have to do a letter of commitment in order to join? No.
There's one document they have to submit. Some communities like to do that because you can, say, hey, we have.
Attach it to a grant.
Exactly. Attach it to a grant. Use it as a PR piece. Kind of really, you can determine how you want to kind of spin it.
Oftentimes grants ask for letters of commitment from leaders. Any kind of grant does. And so that's a nice document to have for showing that our board is committed.
I have another suggestion, too. We meet at Birch Grove every Wednesday for lunch, and maybe in the future, instead of 3 different townships, to come to that to lunch and have lunch, and then, maybe follow up with the 10 points, because most of the folks there are 55 and up. Maybe go to the hub, that's where people gather, is at the hub, so rather than little increments of, and I understand that that's the way you got it started, but maybe some thoughts for the future. Where are the people?
I think that'd be a great way to share our findings more broadly in the community, and to gather some additional feedback in the process. It's a great idea, Commissioner Storley.
In the process, we have become aware of a lot of different ideas of where I think people are already gathering as we've gone, so that's been nice. Right. Yeah.
One of the things I really like is just how well it fits with our community health assessment and community health improvement plan. And, we should be committed to those. And because it fits so well, it seems like a good thing to commit to, right? It just is all part of that. So I do want to be cautious of overcommitting, right, and our limited resources, but it seems to be a really good fit. Administrator, you had your hand up.
Oh, well, a couple of things. I was just going to recognize the great work that you've done. This information is really, really useful. And the effort that you went to engage people in collecting this information is really remarkable. So thank you for that. My questions were really along the same lines as Commissioner Storley and Commissioner Mills in terms of making sure that we do have the resources to fulfill any obligation that the board would make through a proclamation or letter of commitment. I'm always really acutely aware of the workload that all of our staff have currently and how thin everybody is stretched. And I just want to make sure that, and I assume you wouldn't be here making this pitch if you didn't think you could do it, but.
It's very nice that it aligns with the health improvement plan, health assessment priority areas, because then that's work we're already planning to do.
Yeah.
So I see it as additional resources to do work that we were planning to do with that kind of equity lens of how do we make it age-friendly. So.
And I will say, so for this grant, if you're not familiar, the grant we did get to do this work. Care Partners was contracted through the county as the fiscal agent. Also, so that would continue I would anticipate
Yeah.
that we would continue to do some of the work. It's very much in our mission and wheelhouse too. So it doesn't fall entirely on county employees. We're glad. I have a directive from my board to be engaged in advocacy as a part of Care Partners too. So that's something that is really important to us. Yeah.
That's a great point. Thank you. Other questions, comments? Thank you. It's wonderful.
Thank you.
Absolutely.
Looking forward to the rest of the process in the next 5 years and kind of getting the bouncing off, and yeah, very exciting. Oh, Commissioner White?
I really liked how you went out to share information to all parts of the county. The one question I had, did Grand Portage feed you when you were there?
Yes.
Okay.
They made a potato tot casserole. It was good. And I even came out for it. Of course.
That's what, of course, yes.
I love it. We
And they've
learned
invited
that.
us back already to go, to present at RTC.
Cool.
Yeah.
That's great.
There is always good food,
Yeah.
always.
Always.
It was so fun to learn that they were like, if you were coming here, we're eating, right? And we
Yeah.
were like,
We're bringing
okay.
cookies. No.
Awesome.
Thank you.
Okay, well, have a wonderful day, and hope to see you soon.
Thanks.
Thank you.
And that'll move us on to our director's report.
Want to quickly echo gratitude to Julie, Georgia, Grace, and Andrea for their great presentation this morning. Thank you all.
Thank you.
Good morning, Commissioners. Happy spring.
Good morning. For Equinox, yeah.
Oh, it is, yeah.
We'll start off with a staff update. Included in your agenda materials is an updated organizational chart. Very excited to be welcoming Rocio Rivas to the team. She started in February, initially as a temporary hire. She came in to provide some immediate support as we had 3 vacancies on that team with 2 promotions and 1 resignation that had been vacant for several months. She ended up applying for the permanent vacancy and was selected for that position. So really happy to have her have that heads up on training and onboarding process. The other postings for those 2 other support staff vacancies closed yesterday at 4 with a deadline of the end of this week for merit system testing as a condition of participating in the merit system, which we're still in for the next year. Some of our positions do require testing, so this case aid position being one of those. We had interviews last week for the adult mental health case manager position and coordinated crisis response position, moving forward with both of those with some optimism that we'll be able to fill those positions that have both been vacant for about a year and a year and a half, respectively, or just over a year and about 6 months, rather. On the consent agenda, you accepted with regrets the resignation of 2 of our adult services staff members. In terms of where we're at with backfilling those positions, we did initially post the developmental disabilities case manager to internal candidates, as the incumbent had been in that position for 10 years. And that has not been open in quite some time. I don't believe we had any internal interest, so we'll be opening that up externally this week. We did break from our more recent tradition of always posting positions internally with that adult services social worker position, as that was vacant just over a year ago when Anna transferred into that position from her adult mental health position. And just given 2 vacancies on 1 team, wanting to really expedite that process and having both internal and external candidates considered for that position. So again, want to thank both Julie and Anna for their years of service. Again, Julie was with us for over 10 years, Anna just over 4, both in adult services and then prior to that on the behavioral health team. It's really hard to lose staff, especially when they have longevity with the department, but wish both of them the best in their new endeavors. As I understand, both have accepted new positions in the field, so continuing to do the good work just with other service providers in our community or through remote work opportunities. Another staff update is that we are grateful to be working with Mike Flatley, who is a peer recovery specialist with Grand Portage Human Services. He is interning with Greg Barnier, who's a licensed contractor and drug and alcohol counselor with our department. So learning a lot about Greg's clinical practice, working under his license and interning through that wilderness outpatient treatment program. I want to give kudos to a number of staff for their continuing education. Andrea Orist and Brenda Port have both recently achieved certification as harm reduction specialists. This is a part of our Rural Communities Opioid Response Program initiatives. So grateful that they both have committed their time and experience to increasing those resources to support people in or seeking recovery in Cook County and Grand Portage. Also want to recognize Anna Ross, who recently graduated with her Master of Social Work degree. Also want to share with you all that early next month, I will, along with County Attorney Hicken and Judge Hankey, be attending NACO. It's a National Association of Counties Peer Exchange in Arizona. This will be with a focus of convening county, court, and justice leaders, and it is a framework for cross-system collaboration peer exchange. So again, grateful for the invitation from Attorney Hicken. We did get funding support to offset the travel expense for this day and a half long event, again in the first week of April in Arizona. So looking forward to learning more about other community coalitions and what we can bring back to help support our crisis response pilot here in Cook County. Moving on to agency updates, Governor Walz proclaimed March as Social Work Month in Cook County, so I'll just take a brief moment to read that proclamation from the Governor's office in recognition of the social work staff, both within our agency and throughout Cook County and Grand Portage. For years, the social work profession has been dedicated to improving society's well-being and enhancing the basic needs of all people. Social workers are the largest group of mental health care providers in the United States and work daily to help people both in person and remotely overcome substance use disorders, mental illness, and trauma. Social workers help cope with death and grief, as well as helping individuals and communities recover from increasing natural disasters such as fires, hurricanes, earthquakes brought on by climate change. Social work is one of the fastest growing careers, with more than 17,000 licensed social workers in Minnesota and over 715,000 social workers in the United States. Nearly 800,000 professionals are expected to be employed across the United States as social workers by 2028. Social workers possess the necessary expertise to assist our nation in various areas, including social justice, improved health care, mental health care for all, and immigration reform. And social workers have continued to push for changes that have made our society a better place to live, including livable wages, improved workplace safety, and social safety net programs that help reduce poverty, hunger, and homelessness. And social workers inspire our nation to live up to its values by successfully advocating for equal rights for all. Social workers are employed in all facets of our society, empowering others to live their full potential. Please join me in thanking the social work staff within our team and throughout the county.
Thank you.
Sorry, I'm just getting a message from Melissa about the presentation, so I want to make sure that that's working. I am able to open it, but I don't have the most up-to-date version, and I was hoping that transferred over.
Do you have it open at the moment? Because that might be the issue.
I'll close it out.
Yeah, let's see.
Okay.
So it also looks like it might be locked.
We can take a 5-minute break if you guys want to. I have to use the bathroom, so.
I'd be happy to take a quick break while we work this out, and then I continue with my report.
Yeah. Let's take 5.
Thank you.
Thank you.
My other idea is to have you sign in.
Oh, yeah.
So do you know when you buy a wedding ring and you need it in that 5 days?
Is the
They don't have that.
Aging Communities
So
presentation
Whoa,
available for
let's go
download?
in.
Can I get a copy of that?
What do you have in my size?
It'll be in
That's
the
where
minutes,
you see
but
from.
I can send you one before.
No, I had no idea. I
You know,
never,
I hadn't thought. So I had to laugh because we went into one place, one of the first
It'll be
places,
attached
and
to
there's
the
this
minutes,
young
but
girl
I'll also
at the
send it to
counter.
you sooner than that.
And we're like, he's picking
Maybe
up what
could
he thinks
Allison
I
send it
got
to
one
everybody?
night.
If they want it. I don't know if everybody wants it, but I'd like a copy.
It only takes 3 weeks, and we're like, no.
So I closed out, and I'm missing some
whatever
slides that I
goes
had
in the
added
inbox.
late in the day.
We get stuff we don't
So
even
I might have
Oh, I
missed that.
understand.
No, you don't
Sometimes
understand.
you just get overwhelmed with it and it gets lost.
Can't wait.
Mine.
we can't wait. The baby's coming.
I
He
just
says
saved it
to
on my
her,
desk.
yeah, and she's not even pregnant. And I'm like, oh my God, embarrass me.
No, it's missing.
Oh, go roll with it, Mrs. Johnson.
Mrs. Johnson. Mrs. Johnson.
But I'm closed out. Do you want to try and open it on yours again?
Where'd everybody go?
Or maybe, Melissa, why don't I try and put the drive in
I
my...
have to get up and walk around, 'cause otherwise I won't walk again. Stretch it out, stretch it out. Need to do physical labor without the wind.
See a can of pineapple juice, it must be a party. That's just on the beaten tree
Yay!
Nice.
It's here.
Oh, good.
Okay, so I'll put that on my desktop. And then I'll
Just get birch.
I only ordered a load of birch
update the
to start-
permissions on this.
To start with. I still
Okay,
have maple.
I've
I
got
still-
maple and oak.
Oh, oak.
Who
What is
Who
oak?
brings you oak?
David Howe.
Wow, where does he get that, I
Yeah.
wonder?
Yeah, where does he get that from?
Out of county,
No,
Not in the
No?
county.
there's some swamp oak, quite a bit of swamp oak scattered around. But anyway, we're just getting a cord. We're filling in for next year. I mean, we're wanting to get our green stuff so it has time
That's
to
what I'm
dry.
doing too.
So I've got a section under our lean-to that's emptied out from this year, and so
And that's where I'm at.
Yeah.
No, it's,
it's a process. You're always moving
That's
your
right.
wood. Yeah.
So did you just get wood delivered? Is that why it's not?
I know, yes.
Now you got wood delivered?
Well, the stone's
crazy.
all gone,
Yep.
and the
It's
pallets
perfect
are flat
timing.
on the ground. Now they're not.
I would have been
Exactly.
screwed though, because we have to haul ours back with it on a sled.
Oh, yeah.
So we did that early, and I was like, "Come on, Buffy! Like, we don't need to do it this early. It's so early." And then no snow. We did it all, but whew, lucky
Yes.
I followed her lead per usual.
No, I was thinking, we used to get 8-foot
8-foot logs.
8-foot logs.
Yeah, that's what
and
we
then
did,
we
and
cut.
then-
I could cut chainsaw. I just that was great. And then the splitting firewood. I love splitting
Yeah.
firewood.
Yeah, that's gratifying.
And you
yeah.
just get into this rhythm, and you just
Yeah.
pop, pop,
Yeah.
pop, pop.
Now you pull the lever.
Yeah.
Oh, we have that now.
I like
We
that
got an
one.
electric
I did
splitter in
that-
the garage.
I did that for
Awesome.
somebody for Jim Steele.
So
I
we,
did
summer.
I have a wagon,
But,
and I pull loads of wood in to the garage, and in the worst of weather, I can split
Oh,
it
yeah.
in there. It's really
That's how you
nice.
do that. Chopper Doll, I guess, splits, cuts and splits. If you get a 8-foot logs delivered, and it's like, I don't understand how he does it so cheap, but it's like half the price versus ordering
Wow.
Really?
cut split wood.
No,
Yeah,
when I,
but he can't do it all. You know,
Yeah.
he's got to have limits.
yeah, I just got I was always just too busy. It's like we're
Yeah.
working here, and I'm working with the reservation kids, and I'm on the school, well,
Yeah.
no, I wasn't with the reservation, the school board at the same time. Let's just buy it,
Yep, exactly. Yep.
just buy it. reached that point in my life, we
Saves
just buy it.
you time, you need the
Yeah.
time, yep.
The time.
It's kind of weird because I'm buying it, but I'm also having trees cut that are too big for us to cut down and hauled away. It's kind of, but the spruce budworm, it's like, get it out of here,
Oh, I think about that in
Oh,
farm where I grew up in the barn. My dad paid somebody to take it down and haul it away.
and you think of all that reclaimed wood.
And we went and bought a barn.
Right.
Yeah.
Right. Yeah.
Yeah.
Oh, God.
And how things change. While we learn, we do things
He could have sold
differently.
that barn for the,
I'm just going to
Yeah.
email it to you, Melissa. Is that
Oh,
okay?
absolutely,
Oh, but
absolutely.
you won't be able
Yeah.
to sign it either.
And then I'm not sure how to get it on here.
Well, Ren turned 18 yesterday. It was a very emotional day.
18 almost.
I don't know why exactly. Well, there's two things going on. I mean, largely driven, I think, by her 18th birthday, but for whatever reason, I just was thinking of my mom a whole lot yesterday, and it was just like tears almost all day. It was bananas, and just trying to figure it out. And then we're having a birthday party in the evening with my dad and my sister, and Ren said, "Oh yeah, I dreamed of Grandma like last night." I was like,
Appropriate.
"What?" Yeah, it's just like how.
Grandma was there, what do you think?
Yeah, absolutely. Yeah, it was just, yeah.
I think I can just remote up on it.
Ren has some kind of ESP or something, because she's always really lucky when we play games. She just happens to know right what to pick or do. I bought a camera off the sell-in swap yesterday, and, I justified it for her birthday. It just happened to be on her birthday, and this came up as like, wow, that's serendipitous. But I was the second person in line. The first person passed, and then when I went and got it, the seller told me who the first person was.
Is it your daughter?
No, but then I said, I told kind of the whole story, after the fact, and I said, guess who the first person was? She guessed it, just boom. Just out of nowhere. It was totally random. There's no way.
Is there
Amazing.
scary background music?
Yeah, no.
Shadows or something?
No.
Is it coming through on your screens?
No.
No.
Not yet.
Well, as long as we have it up there,
That's true.
that's the important part.
I think I'll use this as, will it come through on the YouTube?
It
though?
won't.
Oh.
It's like a permissions issue on the file.
I see your screen now.
Yeah.
Oh, that was a little blip there it was on.
Allison?
It did come
While
on.
we're working on that, can I ask you another question, going back a bit? In your exit interview to the two people who are resigning, was there any relevant information? I mean, they left because they got a higher salary, or they left because of different job interests, or was there anything that could be useful in retention in the future?
Yeah, we'll gather that data at the point that they're leaving. HR conducts our our exit interviews.
Okay.
Yes, and
That
we're
would
starting
be
to track that.
Good to know. I mean, with the vacancies you have, they get hit with two more, that must be.
It's-
Well, and there was, when you're on the Windows screen in File Explorer, we did see that for a second. But, so I don't know if you could open the document. Maybe that was just totally random.
It's because no one's signed into that device.
Okay.
We can't open up the document.
I'll
for
stay
whatever
on.
reason.
And you can't save it to the desktop?
That's
or-
what we just tried to do.
It
Okay.
didn't work?
It's still asking for a sign-in.
I'll sign in.
Oh.
I'll do
We
the
tried.
remote up to the screen at that
Okay.
point of the presentation, and then again, the file will go out in the meeting material, so all of that data will
Okay.
be available to the public via the minutes.
All right.
Thank you for trying that.
Yeah, thank you for your patience. Are you ready for me to continue on with my director's
I
report?
think so. Are we, okay, yep.
Okay, all right. So where did I leave off? Okay, so other agency updates, we recently applied for 2 large grants as a department, one through the Department of Employment and Economic Development to continue some of the collaborative childcare-oriented work that we've been doing in partnership with other organizations with a focus on really supporting the development of new childcare providers in Cook County. So that grant was just submitted last week. I'm not exactly sure when we'll learn back on whether or not we were successful in the award of that grant. We also applied for a multi-year grant through the Minnesota Department of Health to continue our substance use prevention work beyond the term of our Rural Communities Opioid Response Program grant. The focus of this grant application is on youth prevention and coalition building that would align again with the work that we've started in that Rural Communities Opioid Response Grant, with a specific lens on youth engagement and prevention. In December of last year, I shared with you that we were put under a performance improvement plan for child support services specific to the measure around paternity establishment rates. This is a situation where, again, we've dropped just 1% below the threshold of performance. The performance improvement plan was submitted to the state and approved. So the next steps is that will be monitored over the next 2 years. Unless the performance threshold is met after the first year, then that will be closed.
And is that with Carleton County?
It is,
Yeah.
yep. So Carleton County submits a performance improvement plan and undertakes all of the internal training and monitoring work to see that through. Within our economic assistance team, we received notice just yesterday from the Department of Human Services that we yet again achieved 95% or higher in processing of expedited and regular supplemental nutrition assistance program applications. So what that means is 95% or more of people who apply for food support benefits in Cook County are receiving their benefits in time, which is 30 days or less for regular applications, or 5 days or less for those who meet criteria for expedited service, meaning they have lower income or resources than their monthly living expenses. So kudos to the economic assistance team, despite lots of change, continuing to meet or exceed those thresholds.
Wow.
With that, unless there are any questions, I'll move on to my presentation on CaseWorks.
Oh, Frank
Allison,
has
can
it.
you give us a rough idea of the balance of the Good Samaritan Fund? I mean, are we talking hundreds, thousands, tens of thousands?
Good Samaritan Fund. So you're referring to the donations report that was included on the consent agenda?
Yeah, I saw the donation report, but what's the total? And the reason I'm asking is because the expenditures outpaced the donations, and I was just wondering what the balance is.
Yes. I don't have that readily available, but could certainly follow up with you. I know that we received more donations than expected in the pandemic. We had a number of people donating their COVID benefit checks to the department to help support people in need. But again, in recent years, we're continuing to distribute more than we're bringing in.
Okay, and that fund is partly funded by donations and partly by budget?
It's fully donations funded.
Fully donations?
Yes.
Okay,
Yep.
so even more important now, if our expenditures are outstripping donations, need to know how much of a cushion there is there.
Yeah, and these resources are targeted to people who aren't eligible for other state or federal.
I get it, yeah. Okay, thank you.
Thank you for the question. So apologize for the technical difficulties with the presentation. I'll just share my screen so at least those of you in the room can see, and we will get this out on the meeting portal via the minutes so that you can, so that the information's more publicly available. Let's see. So earlier this year, you all approved the amendment to a joint powers agreement for a regional electronic document management system that we have had in place within Region 3 for the last 10 years. I gave you a preview at that point that we would be coming back with a request to invest in a new system for economic assistance and healthcare programs, as well as for social services. So this is just an overview at this point of the CaseWorks system, some of the planning work that we've done to date as a department, regionally with the vendor, CaseWorks, and internally with our MIS department.
I'm guessing the green is who's using it already?
Yes.
Okay.
So I'll go into a bit more detail on that graphic, but yes, those are the counties within the state that are presently using CaseWorks for an electronic document management system. The outline in red are the Region 3 counties that are actively transitioning into CaseWorks as well. So what is an electronic document management system? Please forgive me, Commissioners, I'm going to use EDMS throughout the presentation once I explain what that means. It's a mouthful. So an electronic document management system manages the creation, use, and storage of documents related to an individual's program eligibility, care plan, services, etc. It helps staff efficiently organize and distribute documents across the department as well as other organizations and providers. It uses industry standards in business processes, workflows, data security, and encryption of the private data contained in the systems. It serves as a hub for broader information management strategies and business processes. Naming conventions, organization, and structure is consistent. So across those 55 plus counties, we have a really strong framework of how other counties doing the work are using this system to meet their business needs. File and document access is easy and quick, and it improves record compliance and reduces time-consuming tasks around storage, retention, retrieval, and distribution. I'll go into some detail in each of those areas here. So what do we have currently for document management system? For economic assistance and healthcare programs, we're using the on-base system throughout Region 3. So that's those counties in the Arrowhead region: Aiken, Carlton, Koochichang, Itasca, St. Louis County, Lake, and Cook County. St. Louis County is the host county contract for the vendor. They have the servers on site. They have technical support staff assigned to maintaining that system and responding to service requests. That has been in place since 2013. St. Louis County is transitioning to CaseWorks along with each of the other counties in the Arrowhead region, with that regional contract and support ending at the end of this calendar year. In social services, we do not have an electronic document management system. Record management varies by unit and case status. In most cases, we have paper files. In some cases, there are electronic files across a number of different systems, including SharePoint and network drives. We use the Social Services Information System for documentation and case planning and reporting. There are limited document management functionality within that system. We can, for example, upload a child maltreatment report to an SSIS case or intake, but there is no workflow functionality, meaning there's not a way to route a document within social services to the assigned worker or team. And I'll get into more detail around what that looks like. So what do we have now? This is just a snapshot of what record management looks like in the Public Health and Human Services Department. That first image on the far left is our file storage room in the front office. In that space, we have closed files that have not yet reached their retention period. We have open and active case files for individuals who have many, many volumes of records. In some cases, individuals, community members are receiving services from our department throughout their lifespan. So that's quite a bit of documents that we're required to maintain as long as that individual is still receiving services and those records are within the state mandated retention timeframes. Some records are retained indefinitely, adoption assistance being one example. All social services staff have paper files in their office. This is an example of one of the adult services staff who was generous enough to let me in her space and take a few pictures. So that top drawer is all client records. There's a similar drawer below that with client records, and then that taller cabinet are programmatic files. We also have a room in the basement for file storage, several rooms. 2 rooms rather, one with supplies and one with records. That also includes fiscal records as well as programmatic and case file information. In 2018, in response to the lack of space in our file room, we began a process of archiving case files electronically, so creating our own very rudimentary EDMS in partnership with our IT department through SharePoint. So the process there is that we would, at the point that a case closed but had not yet reached retention, would image all of the files into the SharePoint cloud storage so that if that person re-engaged in services, if there was a data request, that we would still have those records, but it wouldn't be taking up the physical file space in our records room. We ran out of space in that SharePoint file and have since purchased a network drive to have more cost-effective, more secure storage. And again, that's maintained by our IT department here. This is just a glimpse at our complex electronic storage system. This is a document, you won't be able to read it, but that's okay because it's not 100% accurate. There are a few changes that I need to make to it. But this is an image that the MIS team put together to illustrate how we have records managed across the department. So for administration, adult services, behavioral health services, economic assistance, family and children's services, fiscal, front office, and public health. So for each of our units or divisions, we have varying rates of utilization of network drives. So in some cases, we are fully using the S drive, which is a network drive that are gradually being phased out across county government in favor of the cloud. So for fiscal and adult services, an example, they are fully using the S drive for records. So in that sense, we do have some client records on the S drive. Other teams are utilizing Teams or SharePoint to a higher degree. Children and family services, behavioral health, public health, for example, are all using Teams primarily for storage of documents that would include both programmatic and client records. We have the ability to lock down channels to restrict access to ensure that only those with a business need to access private data are accessing that data. So a parallel process in addition to the EDMS systems investment is looking at our other records as a department and really streamlining and being consistent for how we're managing those documents across divisions.
So there's still going to be some non-EDMS electronic filing. Hopefully
Yes.
not much in the
Policies,
paper.
procedures,
Okay, sure.
resource guides,
Yep.
those will all continue to live in SharePoint. Our goal
Okay.
more broadly is to move everything from the S drive to SharePoint and Teams,
Okay.
and to move all of the client data from both of those systems into EDMS.
Okay. James? or-
That was my question.
Oh, okay. Commissioner White, yes?
And so does that mean as you go through the paper cartons, you can shred them?
Yes, if they are retained electronically, we do
Yes.
not need to retain paper.
So how many more do you have to go?
Oh, well, we haven't started, right?
Big
No, you
question.
did start.
It's,
So we started with a very narrow group of cases that are in that status of closed, but still within the state-defined retention
Oh.
periods.
So another 4 or 5 years, maybe?
Yes, that's my assumption, is that we'll gradually be able to
Yes.
phase out that SharePoint and network drive storage for the archived files as they reach retention. We would not dedicate the time and resources to
Yeah.
imaging those into the new EDMS system, but that's again where we can get advice from CaseWorks in terms of how other counties have approached this, because again, we're not alone in having wide and varied systems for document management. I'm going to keep going. Benefits of EDMS, efficiency, so that document workflow and case file organization. Just to illustrate what that looks like, that can seem kind of obscure. We have an EDMS in economic assistance. I was around at the point that we transitioned from paper files to EDMS, so I can speak to what that change felt like 10 years ago and what that looks like in terms of business processes at our front office. So if someone is submitting an application or documentation, that could come in a variety of ways. They could drop it off at the front desk. It could be mailed in. It could be faxed. With paper files, that's a process of sorting through mail, sorting through faxes and documents, and routing it to the assigned worker. Around the same time, 10 years ago, that we transitioned to EDMS for economic assistance and healthcare, we also transitioned to a case bank system. So the benefit of that is that documents as they were submitted would be routed through the front desk, scanned in, associated with either a pending or existing application or individual, and assigned to that worker or team and available immediately at their workstation at the point that that was scanned. So rather than the risk of documents getting lost in the mail or an individual worker having to prioritize a stack of paper documents on their desk, there's a streamlined, intuitive system that will get that document or application to the person that it needs to in order associated with state required mandates for application processing. So it's integrated with state systems, those being SSIS, the Social Services Information System on the social services side, and with Maxis, MMIS, MEC squared, and METS, which are some of the state systems that we're required to use to determine eligibility for healthcare, cash, food support, and child care assistance. Customer service. The CaseWorks system includes a customer portal so that individuals can submit information electronically without having to come into the office, without having to mail, email, or fax documentation. Again, those applications or documents are processed in the date order received or as defined by other state mandated deadlines. And staff are able to quickly filter or search to locate information rather than paging through a hard file. Data security, within the system there's electronic history of document access, ensuring that only those with a need to know are accessing client files. The system is password protected. Documents aren't left out at workstations, in a vehicle for hybrid or remote workers. Again, a much lower level of risk in terms of the private information that we would be accessing and supporting an individual or family. Yes, Jean?
So if somebody's like entering information into a form, is there a way to quality assure, like if they, for example, insert an errant character in their last name, is there a way to catch that, or how does that work?
Yes, so that is where the integration with state systems is able to associate those unique identifiers, whether it be a case number, a social security number, a date of birth, with the client's record in that state system.
Great, thanks.
So again, here's the map of the currently 55 counties statewide using CaseWorks. That crude line around the Arrowhead region shows the counties Koochiching, Itasca, and Lake, who are also contracting or pursuing agreements with CaseWorks. St. Louis County and Carleton County have already gone live with various stages of CaseWorks. CaseWorks is a Minnesota-based company exclusively supporting Minnesota counties to ensure that functionality is not compromised across other state requirements. As of 2021, they have a 100% customer retention rate for 12 years running. Minnesota County feedback. What are those other counties saying about CaseWorks? How has it changed their service delivery? This is from Rice County. CaseWorks has made us much more flexible. It makes transitions easier too if you have turnover. These files are organized the same for everyone. No big surprises for people that don't file and organize. This is highly relevant to our team right now, given the frequency of turnover we've experienced in the last couple years. We have had some surprises when positions are turned over and files are not in great shape, and it's taken some work to kind of rebuild or pull that information together when it's saved in different disparate locations. From Goodhue County, Red Wing area, this worker said that a pro is that they have great support and it's ongoing. They rock in this area compared to on-base. So Goodhue County also transitioned from on-base to CaseWorks. You can call or put in a ticket. They're very fast in getting back to you, kind, and will help you on your computer. A pro is that you can privilege cases in like SSIS, which on-base didn't have. So again, on-base is the current EDMS provider for economic assistance and healthcare in the region. Support has been positive but limited, I would say, due to the regional hosting model. So communication, new forms, it's a more involved process working through St. Louis County. With CaseWorks, we'll have our own instance of CaseWorks, allowing a lot more customization of the types of forms that we want to use to match our processes here in Cook County across all programs. Privilege cases. So just to explain what that means is there are circumstances in which we would restrict access to a case file. This could be an individual who is participating in the Safe at Home program, which is a statewide address confidentiality program. Could be a conflict of interest internally where a person receiving services is of close relation to a staff member, and we want to restrict access to that record to prevent incidental exposure of their information. Finally, Nicollet County, another smaller county in the St. Peter area. A feature we're really looking forward to with this SSE, that's the Social Services EDMS, is the mobile version. So our social workers can have full access on the go, being able to fill out documents with a client, save the document to their case file, and if needed, send a copy via email to the client, all within a couple of steps. This has the potential to revolutionize our work with people in the community, whereas now we have, a paper form that's printed out, mailed, faxed, maybe it's emailed. This will really improve ease of access for service recipients and staff to be able to fill out forms on a mobile device and have it automatically go into that case record system. Again, reducing extra steps and risk involved in transporting and emailing private data. CaseWorks features. I'm not going to spend a lot of time reading through all of these, but we'll just highlight a few that I haven't already addressed. So that industry standard, the 55, soon to be 60 of 87 counties, over half the state. It's not a statewide system in which we would have access to all other documents across the state, but that naming conventions, the organizational standards are consistent across counties using this system. So there's that economies of scale, that ability to see, here's what we can adopt for our business practices, here's what we need to customize. Autofill forms and packets. Again, this is another huge potential for efficiency in that CaseWorks, as opposed to our current systems, will autofill client demographic details, agency worker details, reducing manual errors. In many instances, a set of forms that would normally take a worker 20 minutes to fill out before sending will now only take 2 to 5 minutes using that autofill functionality. Similar with form history, so saving data in forms that require annual updates, one of these being min choices workers who are reassessing individuals for waiver eligibility or services on a regular basis that can automatically pull in all of that data rather than requiring the staff member to manually enter that every year. Case transfers. No need to sort through thousands of pages of bulk files. Documents are saved in order. grouped by file section, and sorted by date. So as an individual relocates to another county, this will streamline the process of transferring their records. Oops. EAS alerts. This is a newer system statewide through the Department of Human Services. EAS stands for Encounter Alert System, and this allows providers to opt in to information exchange to receive patient encounter data that could be relevant to an individual's eligibility. So example of this would be adding an automatically eligible newborn to a mom's case at birth, ensuring that they're enrolled in the health plan and that their health care coverage is established at birth. Security I spoke to already, including the ability to secure privileged cases to select workers, securing adoption records, and providing improvements in data privacy and security across the department. That mobile application, eco-friendly, we're reducing and eliminating paper forms in many cases and documents, which in turn reduce physical storage. Productivity potential with some of those efficiencies built into the system. And again, it's a Minnesota-based company. They really understand some of the challenges that we have with the state systems and how that contributes to the need to having a much more functional electronic case record system. This probably looks familiar. I presented this graph in my year-end report. I did put in a projection here for 2024 based on what we've seen just the first few months in increase of intakes across all program areas. So continuing to see an increase over the last 10 years, 31%, and increases over that last 5 and 3 year period as well. These are new requests for services, incoming reports. This is even more dramatic in terms of the number of unduplicated clients and work groups. We've seen a 91% increase in 10 years. That projection for 2024, again, is based on the number of clients in work groups for the first 2 months of the year as compared to the first 2 months of 2023. Data requests. This is a big area for improvement where we are seeing an increase in the number of data requests coming through both our county website or to me directly as the responsible authority for the department and our data. This could be individuals requesting their own data for court hearing or for other purposes. It could be a discovery process in which a requesting party asks for specific information. Retrieving the data, copying the data, reviewing, redacting, determining where the data even is a very time-intensive process. I'm currently the only person in the department that is trained in our data procedures, so whenever we get a request, it's all hands on deck, and I'm able to pull some of the data directly from SSIS in many cases for social services, but the process of figuring out where that case file record lives, if it's in an individual worker's cabinet, if it's electronic, if it's some of both, requires a lot of time-intensive work between myself and that assigned worker, their supervisor. And again, an area where CaseWorks would improve that process significantly as everything is in one place. So cost summary. These are the initial budget projections for both the financial or economic assistance, MNsure, and social services environment for CaseWorks. We were presented 3 different cost models from CaseWorks. The one that we're presenting is the lowest cost, and I can say more about why we feel like this is the best bet for Cook County at this point. Other models that were presented included a cloud-hosted model. Many of the other larger counties in the state are looking at cloud-hosted. The total expense over 5 years was, I want to say, $100,000 more than the 5-year expense for hosting through Candy Ojai. Candy Ojai is providing hosting services for other small counties throughout the state, and several other counties in Region 3, smaller counties, are also pursuing host contracts with Candy Ojai to receive some of that support. The third model that was presented was an on-premise model in which we would have the physical servers here, and our IT staff would be much more involved in the creation and maintenance of that EDMS, and in consultation with Ronan and his team, determined that that wasn't something that we could invest resources in at this point from the IT standpoint.
Just for the sake of argument, was it cheaper than the Candy Ojai yet?
In terms of the initial startup and ongoing
Sure.
costs, yes, but some of those costs
Then
aren't
we have
reflected
these,
because they
yeah,
would be reflected in
IT
additional
costs.
IT
Yeah,
resources.
totally. Well, the reason I'm thinking along those lines is because if we're hosted on Candy Ojai servers, our security is dependent on Candy Ojai's security, and their security is based on their employee training and competency, not clicking on the wrong thing. So that makes me nervous. You and
And
the
redundancy,
team.
right? Lack of redundancy. If we're talking about being hosted on a single server, I would think we would be more vulnerable. Like if there's a fire there, for example, isn't there a greater risk of just losing the information versus a cloud system where there are multiple points of?
Yeah, I mean, probably, but I think like our server rooms has a special fire suppressant or whatever, but yeah, I'm sure that's possible too, but that was just the first thing that came to mind is like, yeah, we're dependent on their, and I don't know anything about their security or IT, so that's just another thing, but Rowan and you and James can work through that, but just food for thought.
And Rowan is connected with the MIS director in Candy Ojai to be able to follow up on some of these questions. And before I present an ask to this board, I'm happy to address those directly in email or in a future board meeting in terms of how many counties are currently contracting with Candy Ojai, what are some of their data storage and redundancy standards. Again, they're providing the service to other counties in the region. So my working assumption is that they have that in place, but we haven't gotten into that phase of the host county contract yet.
The other factor I wanted to consider, that the cloud-based is $100,000 more. Is that just the setup, or is that the?
So it's a lower initial investment, but a higher ongoing expense for that cloud storage. So it was almost twice the amount of annual expense for cloud.
And the reason I was wondering about that is because, and forgive me for going to worst case, but say there is a ransomware in Candy Ojai and our data is held ransom, that cost is much more than $100,000, to get that back. So it's just, playing the game and trying to figure out the balance here. So, but again, I trust our IT staff and you and James to be able to navigate all that, but just some initial concerns. But I was waiting for it. You've done an excellent job of presenting the pros, and so I was waiting for the cons,
Always risks.
Yes.
So that total expense over 5 years, $279,000. That is after federal reimbursement. So for economic assistance and healthcare programs, we are able to report expenses to the state and receive 50% reimbursement. That percentage is a little lower for social services. This cost model includes a multi-county project discount. So that's a major factor in recommending that we move forward this year with the rest of Region 3 is so that we can capitalize on that pretty significant savings by going along with other counties in the region. I believe it's 40%.
Wow.
Annual support is prorated based on go-live date, so that is reflected in the one-time costs. The host county setup fee may also be prorated. That isn't something that CaseWorks was able to speak to specifically, as that would be determined when we're negotiating that host county contract. So projected budget impact for 2024. Looking at that initial one-year expense of $165,795, again, that's after the federal reimbursement. We have a few different revenue opportunities to consider to reduce the impact on our fund balance, as this is not a budgeted expense for 2024. This is consistent with other counties in the region. Using some of the unwinding funds that were allocated in the last legislative session to support counties with the re-enrollment of healthcare programs. Following those pandemic-related waivers that were in place, we have just over $32,000 that we could use to offset the initial expense. 4E, reconciliation. This is a one-time Department of Human Services payment related to some fiscal forensic analysis of our social services time study data and revenue. So again, we have $34,000 that available this year to reduce that initial investment. Other social services revenue. So again, we have other opportunities to consider here to reduce that impact of fund balance. One that I am exploring is some of the grant funds that we received through the Arrowhead Behavioral Health Initiative as startup costs for our coordinated crisis response pilot. That position's been vacant now for quite some time. So we have, although we are accessing some of those funds to support John Speaker and Andrea Orest's time as they continue work on that pilot, there might be opportunity to allocate some of those funds, as this would serve as a case record system for our coordinated crisis response pilot. Not including some of those other questionable revenue sources, the anticipated use of fund balance for 2024 would be $98,500. What are we currently spending on our EDMS? For child support in the on-base system, this is in addition to our contractual agreement with Carleton County for purchase of service of child support services and staffing time. We also pay for one license. Economic assistance and healthcare. Currently on base, our annual expense is $13,400 for the licensing and support. Social services is a little more difficult to quantify. Rowan and I were emailing back and forth trying to figure out how do we determine what we're currently spending on some of those SharePoint and network drive storage. And he said based on the data that is currently allocated for cloud storage, including active and backup, that it's about $500 per month for cloud storage. And the on-prem storage is roughly in the $6,000 to $7,000 ballpark, with regular replacement schedule that would be reoccurring cost every 5 years. So 2025 and ongoing would not have that child support and on-base expense. Social services, again, that's a little more questionable in terms of the implementation and how long we need to keep those network drive and cloud storage in place. By comparing our annual expenses for economic assistance and healthcare alone, that ongoing annual expense, about $15,000 as compared to $26,000 going forward for economic assistance, healthcare, and social services. So again, that's not a perfect comparison, but in terms of the ongoing annual expense, about $10,000 more for a whole new system that serves all of social services.
Okay.
Did you have a question, Commissioner White?
It was just the previous slide.
This one.
That one, if you added those together, you're 25, 26. You got 27, but that wasn't the case.
Yeah, right. That's it. Yeah. It was just those first two. Is that right? Yeah.
Right.
Yeah.
Yes.
Yeah.
Got it.
So here's a snapshot of the timeline. I'm not going to go in great detail here, but we are here in the Blue Arrow project approval phase, seeking support to move forward with a statement of work and contract to present in April. With board approval to enter into agreement to make this investment, we would be kicking off the project in late May, so a pretty quick turnaround. time with an all-staff kickoff for economic assistance and healthcare the week of June 1st, and an all-staff kickoff for social services the week of July 8th. User setup would begin in July for economic assistance and in August and September for social services. Training would happen throughout September and October with a go-live date of September 23rd for economic assistance and healthcare and October 21st for social services. So that is the overview. Again, no ask associated with all this information today. Just wanted to give you the broad level of why we're recommending this investment, what we anticipate that budget impact will be for 2024 and ongoing. And we'll come before you in April with a more formal request to contract with CaseWorks.
I mean, it seems like we don't have a choice, basically, because of the region and the state, you know, So thank you for explaining it all, but I mean, and it seems like the way to go as well, right? But it just doesn't, I don't know, it doesn't seem like we have a viable option otherwise.
And I will lay out what those options are.
Oh, okay.
Very limited next month, but just to kind of walk you through what I see them. I do not see continuing investment in on-base as a viable option for us. I didn't look into what that expense would be because that is so centralized with St. Louis County. We just could not replicate that here internally without significantly increasing our MIS resources. We could...
Well, you don't need to brainstorm other options right now, but just, that's what I was feeling like, okay, this makes sense, but like, what are the cons? And it doesn't seem like we have much of a choice. So.
And it's the opportunity too of the multi-county discount will be
That's
a
huge.
significant cost
All big
savings
time.
if we move forward with the rest of the region this year.
Commissioner Strobel?
Yes. Could you send that to us ahead of the next meeting?
I will, yes. I'll
Because
send it just
is
this
a-
afternoon.
It's always a
Thank you.
lot to consider, because then we take it to the board the next time, the end of April. So we need to know ahead of time. Thank you.
Absolutely.
I'm pretty excited. I mean, I know it's a bigger cost, but I hear constantly of the frustrations with the different systems and how they're not compatible and just all the shuffling and the time involved and turnover time, both for clients, you know, the public as well as with staff, just as far as processing and all that. So I think it's a win-win-win-win-win, aside from the cost, which is nothing to sneeze at, but maybe just the reality of where things are at. Other questions or comments?
I was just going to say,
Please.
maybe that would help with staff retention if they're working with easier systems than running around looking for a piece of paper all the time. I mean, just a possible.
Absolutely. That's what I was thinking too.
If we can make it through the learning the system.
Yeah.
Well, there's that too. Yeah, the change is
That's
hard.
my
Yeah.
hope, yes. I share your optimism.
Okay. Well, we have 6 minutes left here. Actually, that clock is different than what I got.
Mr. Chair, if I-
yes, please.
If I could just note, we also have a very full committee of the whole
Right.
agenda, so it'd be helpful to start on time.
Yep. So, on that note, let's run through these committee reports. Please share anything that is pressing, and else maybe we can save it for another time. So first one is Active Living Steering Committee, Commissioner White.
What do you want me to share? Let's see, I don't have anything unusual. The Arrowhead Health Alliance,
Yeah.
you did that, the
Well,
last one.
The last one? Yeah,
The last
okay,
one,
yeah,
okay,
yeah.
and,
AEOA, anything?
I Council on Aging, AEOA did not meet.
Okay.
They canceled, and then the Council on Aging I reported last time. So,
Oh, did you forward that request or talk to James about that?
yes, I did,
Okay.
James, and I suppose James will take it from there. The request that came to me from AEOA about supporting their construction endeavors or expansion endeavors.
Yes, I did receive that.
And I don't know what to do with that. And
Okay.
so I'm assuming you will let us know.
Yes, will do.
Talk through that,
Thank you.
Yeah, thank you. Let's see here, moving on to ARC, Commissioner Hawkins?
I was not able to attend the last meeting, but I do have a couple items that I they want to make sure, one is the probation position, clerical position. They really want an answer from us of.
It's on the agenda for
Okay,
next week.
that's what I emailed him. But just want to, heads up, that's kind of important to let them know. The other item that was discussed at the meeting was Senate File 3904, extending juvenile courts to age 21 from 18. There's concern at AJC about they do not have the capabilities or the resources to separate youth and adults in that space. So if 21-year-olds are classified as a juvenile, that will create havoc with Arrowhead Regional Corrections. So that is a concern. That was an issue that's down at being discussed at St. Paul, and there's probably some concerns both sides of why that's being proposed, but we need to speak to our legislature that in our area, we don't have the resources available for having 21-year-olds mixing with 14-year-olds. So that were the heads up that I got from.
Thank you. Okay. Let's see, childcare solutions?
We meet next month.
Okay, thank you. And my thing keeps jumping around here. Community Health Board, nothing to share from what I haven't shared already. Let's see, local, we have the Mental Health Advisory Council. Rana, anything to share?
Well, just a wonderful report by Andrea Orist on restorative justice. I mean, not Andrea, but the group in general is just fantastic program, really successful. So that was very nice.
Thank you. Oh, that's exciting. Get the update there. And then, of course, restorative justice, Commissioner.
Didn't meet in February. You have the
And
report.
forgive me, Commissioner Johnson. I think you said Commissioner Hawkins before.
That's okay. That's okay. Not everybody knows.
Oh, is it, so is it Commissioner Hawkins? This is, oh,
No, officially, I am Commissioner Johnson
Okay.
now legally.
okay.
Yes.
I better stay legal here. Yes. Council on Aging had a wonderful report, but anything to, okay.
Yes, coming along.
And emergency preparedness, Commissioner Sullivan.
Just a reminder, we have Emergency Preparedness Conference next month on the 19th and 20th. And last night, our Emergency Management Director and MIS Director met with the fire chiefs to talk about fire danger in the Arrowhead, which we know is very high, and all the concerns we have for this spring and summer, and to talk about how we're going to work with the public, making sure they're aware of our emergency evacuation registration form, which is online, our wildfire sprinkler protection system survey, which is online, and that you can now use your phone to access that. And that's really, really important information we'll be rolling out to the public.
Excellent, thank you. Healthcare Planning Committee, Commissioner Starley.
Next month.
Okay. NACO, Commissioner Starley.
I'll report next month.
Thank you. Nemogen, Commissioner Johnson.
Meetings next week.
North Shore Collaborative, I don't think I have anything for the report. Getting the feedback from the strategic planning. And then Public Health Advisory Council, Frank.
Yeah, had a great meeting. Moving ahead, Allison presented the existing bylaws, and we discussed and we reviewed them, and continuing discussions on updating the bylaws. Hasn't been done for several years. We're also moving toward hybrid meetings starting next month, and we're expanding our efforts to recruit new members up to the statutory limit. I don't think we'll ever get to 25, but certainly do a lot better than the 6 that we have. We enjoyed our first new member last month, and moving ahead with that. Also, briefly, Allison had arranged an invitation to the CDC's Office of Rural Health for May 7th. That didn't work because there is a rural health conference There's a rural health conference that is happening at the same time. So we're going to have to rearrange a different schedule for that. But that brought up a related suggestion of mine that we consider the NRH, the National Rural Health Association. That is something that we might want to consider joining, but I can get you more information about that at a future meeting if you think that's appropriate. I'll discuss that with Allison. And who knows, maybe next year that someone will be attending the National Rural Health Association Conference in May.
Thank you.
Thank you.
So
If
yeah.
I may quickly, Commissioner, apologies for butting in. The year-end report was also included in the board material, so I want to draw attention to that, summarizing the 2023.
And finally, the Office of Rural Health also has a webinar upcoming on Healthy People 2030, focusing on the goal of improving the number of counties that have community health assessments and community health improvement programs. And that leads me to the big shout out to Allison and to Grace Grinager for their efforts. Thanks to this, we are way at the front edge and way ahead of the curve on this. So thank you very much for moving ahead with that. You have already met the public health, Healthy People 2030 goals. Thank you.
Excellent, thank you. And anything for the good of the order? Then we are adjourned.